Hi, my name is David Gruber. I am the Development and Communications Director at the Metro Dallas Homeless Alliance. That means that I don't do any of the real work over here. That is done by my colleagues. I have the honor of telling you about all that work, communications, and then demanding that you pay for it, development. Welcome to Ending Homelessness in Dallas, Putting Theory into Practice, in which I tell the story of how MDHA is leading the development of the homeless response system that will make homelessness in Dallas rare, brief, and non-recurring. Incidentally, I am much better live, so if you like what you watch and hear here, you can invite me to speak through the contact info on the slide. MDHA leads the development of an effective homeless response system that will make the experience of homelessness in Dallas and Collin counties rare, brief, and non-recurring. MDHA brings together more than 85 shelter, housing, and supportive services programs in retooling homeless services into a crisis response system. So what is the scope of the crisis here in Dallas? Though we constantly track those experiencing homelessness, our annual homeless count, conducted every year around the same time, is the most comprehensive effort to arrive at the number of those experiencing homelessness at any one time. The January 2020 homeless count showed that we have 4,471 persons experiencing homelessness. Of those persons, 1,619 are unsheltered, 368 are veterans, 503 are chronically homeless, and 662 are children. The origins of the modern homelessness crisis begin in the late 1970s to early 1980s. It's difficult to narrow down one decisive cause for any social problem. However, roughly speaking, there are two major, somewhat technical societal shifts that brought about this crisis. First, many persons with mental illness were deinstitutionalized, and the hospitals they resided in were shut down. Second, a type of low-cost housing, primarily for single, underemployed, unskilled, and/or disabled men, known as single resident occupancies, or SROs, was largely discontinued. Many of those affected by these changes became homeless. Now, the homelessness had existed before. It had not existed in the numbers akin to this crisis. Much in the way we deal with natural disasters, in the 1980s, our society attempted to deal with this problem through the use of emergency shelter. This did not solve the problem. In the 1990s, the federal government and related public and private entities decided to address the problem through transitional housing programs, replete with myriad rules that the homeless needed to abide by. The hope was that the homeless would graduate from these often lengthy 24-month programs, quote unquote, housing ready, and be able to move on their own into stable permanent housing. Unfortunately, only a minority of those who enrolled in these programs ever reached that goal. By the late 1990s, governments and communities were tired of managing homelessness. They wanted to end it. The federal government and local communities needed a viable alternative to the traditional model, but one did not seem evident. Around the same time, a small program in New York City was being tested and was slowly gaining ground. This program/philosophy was called Housing First. The idea of Housing First was simple. Rather than trying to, quote unquote, fix people and then house them, these practitioners suggested standing the classic model on its head. House people with two conditions only. They would need to abide by the terms of their leases and meet periodically with a case manager. They would be offered wraparound services to help them deal with their challenges, and they would be encouraged to use them. However, unlike in the traditional model, they would not be forced to do so. As opposed to the classical program that worked only for a minority of participants, the Housing First program worked for about 85% of those enrolled in it. These 85% were able to achieve stable, permanent housing. And though this program began with a small group of chronically homeless persons in New York City, these numbers held up in study after study, in community after community, in setting after setting. This led the consensus of scholars in the field to endorse Housing First, and the federal government to eventually follow suit and mandate that all programs follow this philosophy. The message to all American communities was clear. The federal government would no longer fund the management of homelessness. It was time for the modern homelessness crisis to end. As this was happening, in the 2000s to 2010s, communities were developing more and more permanent supportive housing programs for the chronically homeless and for others in need of a permanent setting with intense wraparound supports. And during the Great Recession of the late aughts, a related idea called rapid rehousing, designed for non-chronically homeless persons, proved promising. The idea was that most of these individuals could be quickly housed, offered intense wraparound services for a limited time, and get back on their feet and move on in 90 to 180 days. And as these models gained ground, the federal government encouraged communities to shift their resources to fund programs that followed them. Conversely, it began to discourage the use of transitional housing programs due to their low success rate and high cost. At the same time, the federal government realized that it was not enough to build and fund these housing programs. Just having the resources available to help those experiencing homelessness would not suffice. Like every product, commodity, or service, without a delivery system, communities could not deal with their challenges. And this was especially true given the scarcity of the resource they were trying to deliver, housing for the homeless. This is why in its landmark legislation on homelessness, the 2009 Homeless Emergency Assistance and Rapid Transition to Housing, HARTH Act, and in Opening Doors, the original National Strategic Plan to End Homelessness established under that act, Congress mandated that there needed to be a homeless response system in every community. And crucially, Congress tasked organizations like ours in most American communities with the responsibility and necessary statutory authority to establish and run these robust systems. So MDHA has roughly 5 important roles it is tasked with by Congress and the President. Facilitate grant funding for HUD-funded homeless services programs. These are referred to as the Continuum of Care, or COC grants. They total about $17 million annually. Administer the Homeless Management Information System, or HMIS, that drives improvement of federally funded homeless services programs. This currently serves about 17,000 persons. Maintain a count of persons experiencing homelessness, and maintain an inventory count of housing and shelter beds for the homeless and formerly homeless. And finally, develop and quarterback an effective, unified homeless response system where all homeless services programs work together to make homelessness rare, brief, and non-recurring. In accordance with this charge, in 2015 to 2017, MDHA built an effective, unified homeless response system. This is an infographic developed by our counterpart in Kansas City in 2014. It still describes what we do in Dallas in 2020. Because, again, the federal government, under the Hearth Act of 2009, expects all communities to build such a system. And such a system has 4 pillars. Diversion. It seeks to divert individuals from having to enter into or engage with the system. It recognizes that homelessness is not homogeneous. It is on a continuum. Many of those who seek our help have the capacity to self-resolve with the help of mainstream resources or light touch one-time assistance. MDHA's 3 largest shelter partners, Austin Street Center, The Bridge, and Family Gateway, have all instituted and now practice effective diversion protocols. Pillar 2, assess, prioritize, and place. It assesses, prioritizes, and only then places individuals into housing. In the absence of such a system, homeless service providers each operate on their own, and when approached by an individual needing help, typically ask some version of this question: will this person be successful in our program? This leads to those with lesser needs and lower vulnerability being served, while those with greater needs and vulnerability are turned away. In an effective coordinated system, the system asks what solutions best match the needs of this person and will end their homelessness quickly and permanently. And the system has one virtual entry point only. At that entry point, the system does 3 things: assesses each person objectively and uniformly using an evidence-based tool, prioritizes each person for service based on the level of their vulnerability and according to their specific needs, and places all clients on a unified housing priority list, referred to as the HPL. And clients are housed based on their priority status and specific needs, with those with greater need and vulnerability housed first. MDHA's HPL is now in such common use in the Dallas homeless response ecosystem that it has become part of the common parlance, and it's often referred to without even mentioning MDHA. Now, not only does an effective system carefully manage the demand side of the housing equation, it carefully manages the supply side of the housing equation. When a unit becomes available, it is filled as soon as possible. Federal housing dollars are fully utilized, and the supply of housing is grown by finding units outside of the COC program. And sophisticated systems include flexible assistance mechanisms to assist case managers, the linchpin of the system, in housing their clients. In Dallas, the MDHA Flex Fund, founded in partnership with United Way of Metropolitan Dallas, gives case managers an important tool to pay for hundreds of minor but impactful expenses every year that can help individuals resolve their homelessness quickly and permanently. And this is a more detailed look at this second pillar, and the technical term for this process is coordinated assessment. It sometimes goes by other names like coordinated entry or centralized entry, but essentially, with some nuances, it means the same thing. All roads lead to housing. The entire system is oriented towards housing as the solution for homelessness, and this approach permeates every component of the system. There's a sense of urgency in getting everyone, and first and foremost those with the greatest needs and vulnerability, into housing as soon as possible, with as few barriers as possible. In the meantime, individuals who need it are offered temporary shelter with the constant, ever-present expectation that they be moved into housing as soon as possible. Since 2015, MDHA has held regular policy discussions, trainings, lunch and learns, boot camps, learning clinics, and roundtables for case managers, program managers, agency leaders, and the public to reorient every part of the Dallas homeless response ecosystem towards this thinking. Data transparency and data-driven decision-making. All homeless service providers must practice full transparency by reporting all data into the Homeless Management Information System, or HMIS, the federally mandated community-wide database that drives improvement of homeless services programs. Obviously, an exception is made in cases of safety. Reporting into HMIS is not simply an issue of bureaucratic compliance. This is the only way we know if and how much progress our community is making. More importantly, this is the only way we can improve and self-correct where we are not. It is impossible to assess system performance in the absence of data on the point of entry into homelessness. Therefore, communities that do not have shelter bed data specifically in their HMIS are routinely penalized for it, as Dallas was. However, unlike the housing programs funded through the Continuum of Care, or COC program, MDHA cannot simply require shelters to enter their data. MDHA methodically worked with each of the major shelters to bring them into the system. And though as recently as 2014, 0% of shelter beds were reported into HMIS, by the end of 2017, the percentage rose to 67%. And by the end of 2019, it had reached over 84%. So with the necessary components of an effective, unified homeless response system in place, MDHA shifted its focus to utilizing while continuously improving the entire system and each of these above pillars. Here are a few highlights of that work. Homeless counts. MDHA conducted the most extensive and technologically advanced homeless counts in Texas history, mobilizing more than 1,500 volunteers each year. Use of the Counting Us app not only made it easier and more accurate, but by capturing the latitude and longitude of each encounter, it enabled outreach teams to aid individuals belonging to specific populations within mere hours of the count. Supporting partnerships for anti-racist communities. Due to the extreme overrepresentation of persons of color in the homeless population, MDHA partnered with the Center for Social Innovation and 5 other cities towards establishing racial equity in homeless services. Hurricane Harvey relief. MDHA, the City of Dallas, the Dallas Foundation, and the Catholic Charities of Dallas joined forces to provide housing, services, and case management to 200 non-FEMA eligible families rendered homeless by Hurricane Harvey. Homeless Response System Leadership Training and Strategic Planning Retreat. This groundbreaking gathering was facilitated by pioneering world expert Dr. Ian DeYoung and former HUD Deputy Assistant Secretary Ann Oliva. With more than 65 senior leaders in attendance, it was designed to usher in a more strategic community response to homelessness. And the resulting Dallas strategic plan to advance the work of ending homelessness was endorsed by the MDHA board. Emergency Shelter Housing Challenge. MDHA challenged itself and its partners to house 90 emergency shelter guests in 90 days. We ended up housing 219 people. Faith-based organizations. To channel the energy of the faith community, MDHA adopted a shared homelessness initiative with Faith Forward Dallas at Thanksgiving Square. A homeless helpline. A key part of any homeless response system, it refers clients to several hubs: youth, domestic violence victims, families with children, single adults, Collin County residents, and general assistance, with each hub managed by a key COC service provider. Collin County expansion. MDHA expanded its assistance to Collin County providers, with a team member officing in Collin County, assisting clients with housing navigation and placement. Inclement weather shelter. MDHA worked closely with its partners to support the provision of inclement weather shelter in both Dallas and Collin counties. And finally, new leadership. Carl Falconer, prominent leader in homelessness services in Jacksonville, Florida, became our new president and CEO in late 2018. Falconer, an 8-year U.S. Army veteran, has worked in our field since 1994, from street outreach to emergency shelter to housing programs, and he hit the ground running when he arrived in Dallas. During the 2019 State of Homelessness Address, Falconer, MDHA's then new president and CEO, highlighted our community's second 9% rise in homelessness. He called for all stakeholders to rally toward one single vision for ending homelessness through his D1 plan. Guided by this plan, Dallas's homeless response system made and continues to make significant progress. And here are just a few highlights of its impact and its ongoing efforts. Ensure D1 plan buy-in and task assignment. Working with a special committee of partners in local governments, nonprofits, and funders, Falconer has received buy-in not only for the plan itself, but has received commitments from necessary entities to take on individual plan tasks. Drive all decisions with data. In 2019, through a careful, HUD-guided, and community-driven process, MDHA transitioned to a new, superior homeless management information system, Ecovia Solutions Client Track. This new system will help MDHA gain 100% participation in HMIS, reduce provider time entering data, create and share user-friendly reports with the community, and enhance continuity of care. It also lays the foundation for connecting the homeless response system with multiple data systems through a data warehouse. Increase rapid rehousing. In 2019, our system increased rapid rehousing units by 18%. MDHA continues to work on securing new sources of funding, reallocating existing funding, and providing extensive and ongoing training and coaching to build staff capacity. Establish and implement a move-on program. In 2019, MDHA partnered with local public housing authorities to apply for and receive move-on vouchers designed to help those in permanent supportive housing who no longer need intense support but cannot afford market-based rent to move on, freeing up permanent supportive housing for those experiencing homelessness. And MDHA is in the process of implementing this program. Improved street outreach. In 2019, our system increased exits to permanent housing destinations from street outreach by 223%. MDHA continues to work on upgrading, systematizing, and ensuring complete street outreach coverage within the city of Dallas. Partner with those with lived experience. In 2019, the MDHA COC Youth Committee conducted 2 of the most extensive youth outreach surveys to date among and with the help of homeless youth, recognizing that the most effective solutions to understanding and addressing youth homelessness are developed in partnership with youth with lived experience. MDHA stood up the new Dallas Area Youth for a Brighter Tomorrow. Currently, MDHA is also adding a person with lived experience to each of its continuum care committees to form a homeless consumer council. Enhanced diversion. In 2019, Family Gateway specifically successfully diverted about 47% of homeless families to solutions that helped them end their homelessness without having to enter the shelter system. Systematized training and technical assistance. MDHA trains providers monthly to ensure the use of leading evidence-based practices. It is working to establish minimum training standards for providers to ensure skill development and competency and long-term program sustainability. Deploy frequent users systems engagement, or FUSE. Through grants from United Way of Metropolitan Dallas and the Texas Instruments Foundation, system partners will place caseworkers in key spots to identify heavy users of community resources, assess, prioritize, and place them on the MDHA Housing Priority List, or HPL, and fast-track them into housing. End veteran homelessness. In 2019, MDHA led its first Veterans Housing Challenge with the goal of housing 100 veterans in 100 days. The goal was exceeded with 140 ending their homelessness. Through such challenges and lessons learned from them, MDHA hopes that in 2020, Dallas will join the 78 communities and 3 states that have ended veteran homelessness. Educate and build community support. Through the Hard Conversations series, presentations in the community, engaging the press, blogging, social media, and e-newsletters, MDHA continues to educate the community on how we can, are already, and should continue to end homelessness. Achieve racial equity in homelessness. There is a difference between equity and equality. With Dallas Truth, Racial Healing and Transformation, or TRHT, United Way of Metropolitan Dallas, Faith Forward Dallas at Thanksgiving Square, and the Child Poverty Action Lab, MDHA is creating and executing a racial equity plan of action for ending homelessness in Dallas. TRHT has begun a pilot to train the bridge management and workforce from the board of directors down to peer navigators. The bridge is already reporting noticeable changes, and concurrently, the partners will soon engage leaders of homeless response system partners to offer similar training. Mobilize the faith community. In 2019-2020, MDHA built on its already established relationship with Faith Forward Dallas to rally the faith community. Faith Forward Dallas helped with the first Veterans Housing Challenge and fought for inclement weather shelter. One congregation is running a pilot through which they are ending the homelessness of one family at a time, and soon they will present to Faith Forward Dallas and urge other congregations to follow their lead. And currently, Faith Forward Dallas is actively planning to mobilize clergy in each of the 14 Dallas City Council districts. The goal is to approach each City Council member and support them in committing to specific numbers of housing units, coupled with applicable services per the needs of the homeless response system. And MDHA will also help clergy to mobilize their congregations to follow their lead and do the same in supporting our 14 Dallas City Council members as well as the mayor in providing these responses to homelessness. Establish a funders collaborative to end homelessness. In 2019, MDHA laid the foundation to establish a robust funders collaborative to help end homelessness in Dallas and Collin counties. In 2020, MDHA is working to make such a powerful mechanism a reality. During the 2020 State of Homelessness address, live streamed on YouTube without an audience in the shadow of the coronavirus pandemic, the no longer new MDHA president and CEO, Carl Falconer, shared the results of the 2020 annual homeless count. Homelessness decreased 1.4% from 4,538 to 4,471. Emergency sheltered homelessness decreased 16.2% from 2,313 to 1,938. Unsheltered homelessness increased 11.5% from 1,452 to 1,619. Veteran homelessness decreased 14.6% from 431 to 368. Chronic homelessness increased 7% from 470 to 503. Family homelessness decreased 10.4% from 1,025 to 918. And child homelessness decreased 9.5% from 732 to 662. The percentage of persons of color in unsheltered homelessness increased from 54% to 61%. The above decrease in overall homelessness, swinging 10.4% away from its trend line, coupled with the decreases in veteran, family, and child homelessness, make one thing first and foremost clear. The Dallas homeless response system has begun to turn the tide in the fight to end homelessness. However, we are not, as they say, out of the woods. We must seize this momentum and redouble our efforts. COVID-19 has lent a sense of urgency to our community's task. Researchers have long held that warehousing those experiencing homelessness in crowded shelters was not a great idea. Time and again, studies have shown that it is in fact cheaper to house people than to keep them in homelessness. Still, the Dallas community, like many other communities, has resisted providing the resources to house those experiencing homelessness, going so far as to let $20 million raised through a bond election in 2017 go unspent. As former Dallas City Council member Mark Clayton said, everyone wants to help the homeless, except in their own neighborhoods. Perhaps the thinking was that leaving those experiencing homelessness in crowded shelters and on the streets would never affect any of us directly. With COVID-19, it will. Towards the end of the 2020 State of Homelessness address, Falconer said that Dallas must apply important lessons from the coronavirus pandemic. It is teaching us, he said, to look out for everyone in our community. It is teaching us that as a community, we can and will go to great lengths to keep each other safe. It is teaching us that our community is only as strong as the weakest in our community. It is teaching us that we are all connected. It is teaching us that a home is more than four walls and a roof. A home is healthcare, public safety, family, community. And we must act now to make this a reality for everyone. Dallas's homeless response system is already reeling, and a tsunami of need may be just around the corner. Nearly a third of U.S. apartment renters didn't pay any of their April rent during the first week of the month, according to the Wall Street Journal. This means that MDHA, which has just begun to turn the tide in the fight to end homelessness, is already and will continue to be severely tested in the days to come. MDHA's work will increase exponentially as it works with its partners to not only continue to work towards ending homelessness, but prevent others from falling into it. It will be directly facilitating the distribution of about $24 million of state emergency solutions grants, or ESG, funded through the Coronavirus Aid, Relief, and Economic Security, or CARES Act of 2020, as well as advising cities on how to distribute their own ESG and other streams of federal funding in a way that maximizes the impact of all of these federal dollars. MDHA will be doing this work in addition to all of its regular work without a commensurate increase in its own federal funding. So what can you do to help? Donate to MDHA. Just go to our website and click on the donate button. Support organizations which are part of our homeless response system. Together, we do what the data and research show really works, not what we think will work or what we hope will work. Go to our website and blog and follow us on social media to learn more. Volunteer for the annual homeless count every year in the last 10 days of January. In 2021, it will be on January 21st. We need 1,500 volunteers to get the job done. Text MDHA to 22828. That's MDHA to 22828 to get on our email list, and we'll let you know when registration for the count begins. Invite MDHA to speak about homelessness and how we can end it. We will come to your workplace, house of worship, social group, or club. In these COVID-19 times, we can do it all remotely too. Advocate for more housing for those experiencing homelessness, paid for by a variety of funding sources, government and non-government, in your neighborhood. Housing is the only proven solution to homelessness. And contrary to popular myth, housing those experiencing homelessness doesn't lower property rates and doesn't increase crime. None of this is easy, but we can do this. Because though it may be hard, it's really not that complicated. Just ask Winnie the Pooh and Piglet. I've been thinking, said Pooh. You have a house, Piglet, and I have a house, and they're very good houses. And Christopher Robin has a house, and Owl and Kanga and Rabbit have houses, and even Rabbit's friends and relations have houses or somethings. But poor Eeyore has nothing. So what I've been thinking is, let's build him a house. That, said Piglet, is a grand idea.